Welcome to Regions Hospital. We are proud to be the hospital of choice in our community for patients of all backgrounds. And our commitment to health equity is really critical to our success. It means that we provide excellent care to every patient every time. It also means that every person that walks through our doors feels welcomed, included, and valued. And we do our part to partner with our community to make sure that we're making a difference in the lives of others. So thank you for your interest in our health equity work, and let's get started.
Minnesota's population is ever-changing. While the state has always been home to Ojibwe, Dakota, and Sioux communities, Minnesota is now home to a number of immigrants from Latin America, Eastern Europe, Asia, and Africa. We're also home to one of the largest Somali and Hmong populations in the United States. Regions' patients, staff, and visitors all have a variety of backgrounds and perspectives. That diversity drives innovation in our work and connects us to the community we serve.
In my intern year, one of the first patients I had in clinic was a young Somali refugee. It was a pretty humbling lesson, but it was also a pretty rich experience. This refugee actually went back to school, she learned English, and she eventually became a social worker, and she's actually been working with newly arrived Somali refugees to help them get resettled now. So it was a pretty powerful lesson in not only kind of learning to work with diverse communities, but learning to really enjoy it as well.
Equity in Care is part of a carefully designed strategic plan with 4 areas of focus: diversity inclusion, language access, community engagement, and eliminating disparities. Diversity and inclusion is about us, the members of the healthcare team. An organization's strength comes from the dedication, experience, and diversity of each employee. Our commitment is simple: every person welcomed, every person included, every person valued. Almost 8% of our patients prefer to speak a language other than English with their care team. To meet their needs, Regions provides access to interpreters, both in person and via phone and video, serving over 80 languages. Community engagement is about going beyond our walls and participating in the communities we serve. By participating with our community, we have the greatest potential to impact the social factors that lead to health disparities. The Regions Health Equity Committee regularly monitors outcome by race, language, and other factors. When disparities are identified, equity and operational leaders partner to close the gap while improving care for all. Every member of the care team can play a critical role in helping achieve our health equity goals.
We are living in exciting times with a remarkable level of energy and momentum around equity. Regions Hospital and health partners have been committed to this work and have been leaders in advancing equitable care in Minnesota and beyond. We don't want to be spectators of this work, but co-creators with our patients. We want to serve as agents of change in advancing equitable care into the next decade.
As you start this new phase in your professional career, you have a tremendous opportunity to join our team in the lifelong journey of providing outstanding, compassionate, equitable care with cultural humility and with the potential to positively impact the lives of all our patients and to improve the health and well-being of our community. We hope you join us in this exciting journey, and we look forward to working with you.